Hi, I'm Julie Richardson. I'm a registered and licensed dietitian and a certified nutrition support clinician.
And I'm Casey Pitts. I'm a registered nurse, and I'm currently enrolled in a master's program to become a midwife. And today we want to take some time to talk about prediabetes and could you be at risk for either prediabetes or type 2 diabetes and why that is important. The CDC defines prediabetes as a serious health condition where blood sugar levels are high, but not high enough to be diagnosed with type 2 diabetes. So 1 in 3 people in the United States have prediabetes, and more than 84% of people don't know that they have diabetes.
Yeah, and as you get older, that number increases. 51% of older adults, 65 or older, have prediabetes.
And prediabetes is very important because it increases your risk of not only type 2 diabetes, but also heart disease and stroke. So, Julie, can you tell us a little bit about what prediabetes and diabetes is?
Sure. Diabetes is when your body can't use the insulin or make enough insulin to control your blood sugars. So when you eat a high sugar meal, your pancreas creates a hormone called insulin. And that insulin helps carry the sugar from your bloodstream to your cells to give them energy. So with type 2 diabetes, your pancreas either doesn't make enough insulin or it makes plenty, but you have this thing called insulin insensitivity, which means it makes plenty, but your body can't use it like it should. And your sugars stay in your bloodstream instead of getting to your cells. So your cells starve and your blood sugar is high.
So prediabetes, you're on the road to type 2 diabetes. So let's talk about what are your risk factors. Although there's not necessarily symptoms for diabetes, some people do eventually start to have more symptoms. But with the prediabetes, we're going to focus on what are your risk factors. So as Julie mentioned, being older definitely increases, but actually your risk increases starting at age 45. If you have a family member, parent, brother, or sister that has type 2 diabetes, then you're at higher risk. Those two.
Yeah, if you are not active or if you have had a baby that is greater than 9 pounds or you had gestational diabetes, you're at increased risk.
Having polycystic ovary syndrome can also put you at risk, and if you are overweight yourself. There are also different races that have a higher risk. African American, Asian, or Hispanic do have a higher risk of prediabetes or type 2 diabetes. Prediabetes equals prevents diabetes. So if you find yourself at risk, then you're at a fork in the road. You have two options. One, ignore it, and the chance that you're going to become diabetic will go up. Or 2, you can start to try to implement lifestyle changes that will help you prevent diabetes. One of those important lifestyle changes is some regular physical activity. So all that means is 150 minutes, not hours, a week of exercise. So 30 minutes a day, even just start as simple as walking. Taking a 20 to 30 minute walk a day can help prevent diabetes.
Another thing that can help, which exercise will also help with, is weight loss. And we're not talking anything drastic. Just 10%, 10 pounds can decrease your risk of getting prediabetes by 7%.
If you're 200 pounds, that's 10 to 14 pounds off. That's it. It's simple to do by changing your nutrition, swapping out that Coke for a Coke Zero, swapping out a sweet tea for an unsweet tea. Just little lifestyle changes as simple as going out and going for a walk, swapping out a few of your foods a week, then you can make a big difference. So when they go to the doctor, what can they expect when they bring this to their doctor's
That their doctor is going to test their blood sugars. There are 3 different tests that they can do for their blood sugars. There's the hemoglobin A1C, which measures your blood sugar over the last 3 months. Okay. And it comes out as a percentage. If it's between 5.7 and 6.4, you have prediabetes. Okay. Diabetes is 6.5 or higher. Okay. They can also check a fasting blood sugar. So you would want that to be between or less than 100. Between 100 and 125 is prediabetes. Okay. Diabetes is 126. Or they could do a glucose tolerance test, but that's less likely. where they would give you a really sugary beverage to drink and measure your blood sugars after a few hours. And if your sugars come back between 140 and 199, that's prediabetes.
And that glucose tolerance test is the one that women also take while they're pregnant that tells them if they have gestational diabetes, which is a risk factor for becoming pre-diabetic later on in life. So the CDC has recognized national diabetes prevention programs. So mention that to your doctor, or you can visit the link that's going to be in the description to see the CDC's page all about prediabetes and all their resources they have to offer. I'm also going to include a link for a test that helps you determine if you're at risk for prediabetes. Any last thoughts for us today, Joy?
No, just be on top of your health, pay attention, talk to your doctor, get your yearly checkups and screens.
It's always better to ask questions and be prepared than it is to wait until you're in the diabetic stage. So thank you for your time.